Have you ever felt like you're chasing your tail, trying to fix every little flaw in your patient's movement? It's time to break free of the biomechanical shackles and discover the power of a functional approach. Let's ditch the myth that patients are broken. Sure, we need to fix what we can. We need to accept that not everyone will have perfect motion. Or you might be on the fast track to burnout. Let's explore a better approach to improve function both for you and your patients. I've crafted this highly technical slide right here, and the myth of perfect form, understanding the functional approach, understanding the patient empowerment, and a final item is a special treat. Make sure you stick around to the end. Resist the urge to skip ahead with the timestamp. Hey, no peeking. So let's start with the problem of perfectionism. Section 1, the myth of the perfect form. Some of the world's best athletes have their own quirky styles. Next time you're watching the Olympics or pro athletes, pay attention to how different they are. They're all excellent and they're all different. The examples I came up with are in tennis, Roger Federer and Rafael Nadal. In basketball, Stephen Curry and Shaquille O'Neal. In the 100-meter sprint, Usain Bolt and Tyson Gay. Each one is outstanding in their own way, and they all have their own unique styles. It's like trying to fit a square peg into a round hole. Everyone's unique. We have to correct what is correctable. And sometimes it's not about being perfect, it's about making the most about what you've got. My current job gives me the time to attend a group fitness class at the gym. It's a barbell class, so a couple times a week I go sweat to loud music. It's a great workout, but the biomechanical diversity is amazing and appalling. So I don't look at anyone. Unless it's obviously a safety issue, I just go on with my workout. It's not my class, I'm not the physio there. It's just one way, there's more than one way to bake a cake. And this is going to sound controversial, but hear me out. There are some physios who identify strongly with being a biomechanical expert. There are different flavors and approaches to physiotherapy. I don't think we're exclusively manual therapists or biomechanical experts. Physio is more than any one approach. Physio is based on improving patients' function. So whether it's a physical constraint or neurological issues, we're pushing for functional adaptation. It's not about giving up on patients, it's about being realistic. I think of the Serenity Prayer. So we've talked about how everyone's different. Now we need to realize that everyone's the same. We all have the same basic functional needs. That's the power of this functional approach. That's why we all learn the same anatomy and physiology in school. Every class wanted us to buy some super expensive textbook, but these are my favorite. I know they're coloring books. Section 2, understand the functional approach. Every person who limps, shuffles, or hobbles their way into our clinic has a story. These interviews, these histories that we take aren't just about ticking boxes. They're about putting your patient's functional loss into a context. I recommend motivational interviewing. That's this video here. Check it out. There's other videos on YouTube about motivational interviewing. I think you got to look into that. It really helps focus your therapy on the patient's functional goals, their needs, their goals, the physical exam, and that's like dancing when nobody's watching. This is what sets us apart from Dr. Google. I did a previous video on what constitutes a functional approach. I'll give you a summary, but go back and check that video for a background ideas. We need 1. Objective measures of loss, 2. Fall prevention, 3. Fostering patient autonomy, and 4. A practical big picture approach. And this big picture approach is to simplify your diagnosis and treatment. That was this other video here. Your physio diagnosis is overuse, traumatic, or systemic, and that impacts on your treatment approach and your future expectations. I also simplified treatment into pain management, recovery of motion, and strength balance mobility. This makes clinical decision making easier. This makes patient education easier. This makes it easier to communicate with everyone else on the patient's healthcare team exactly where you're at and what you're doing and what your goals are. So my functional approach here is to move away from a patient's flaws and move towards a practical solution for their situation. Patients come to physio because they want to help have solving their problems. So let's not blame them for what they've got. Understanding the challenges patients face in their recovery journey highlights the importance of empowering them through a shared decision making. Section 3, understanding patient empowerment. Empower the patient with shared decision-making. Ensure that the treatment plan addresses the patient's functional loss and their stated goals. I like to tell patients what I plan to do in our physio treatments to work towards their goals. Don't promise the moon. I don't know what's going to happen, but we can pick a direction. Patients need to agree to our plan. That's consent. Develop a plan that's realistic. Be realistic with the patient's family situation and the community context. For example, a mother with small kids is a different lifestyle compared to an older person being supported by their adult children. Be realistic with their support system, their resources, their daily life demands. Most of our patients have lives outside of physio. We need to respect that. A key part of patient education is speaking to them at their level. For example, I'd speak to a teenager different than I would speak to an older immigrant patient. Avoid all the jargon you spent so much time learning. Patients don't need your jargon. You're not impressing anybody. Keep it simple. Keep the focus on the patient, not you. If you've watched any of my other videos, you know my 2 patient education rules. Emphasize no pain. Well, maybe just a little bit of soreness is okay. And emphasize don't make things worse. Use relative rest and a moderate increase in activity as tolerated. You might think we've covered it all, but hold on to your hats. You've made it to the bonus section. This is like regular physio, but like magic. Bonus section, neuroscience-informed physiotherapy, also known as brain magic. I have 3 points. First, neuroplasticity is based on use it or lose it. 2, exposure therapy is a key part of physio treatments. And 3, downregulate central sensitization helps patients cope with pain. First, neuroplasticity can happen at any age. It's not just for kids. And I don't mean crossword puzzles and computer games. This is the sensory motor integration and experience-dependent neuroplasticity. There's a ton of fancy jargon to get tangled in. This is the use it or lose it idea. This is why the mental motivation to participate is key to success. I did a video on the mental buy-in right here, this one here. Building on the concept of mental motivation, exposure therapy plays a crucial role in helping patients confront their fears and limitations by gradually reintroducing movement and activities. Exposure therapy is all about gradually reintroducing movement and activities by having the patient voluntarily, that's important, voluntarily approach their fear or limitation. As physios, we can carefully guide patients through these movements in a safe, controlled environment by helping them overcome their anxiety and regain confidence. But it is important here that the patient has to voluntarily choose to confront this limitation. We're just the coach. I talked about exposure therapy in one of my other videos. While exposure therapy is essential for helping patients confront their limitations, it's equally important to address the underlying physiological responses that can exacerbate pain and anxiety. And of course, we're talking about central sensitization. Physiopedia has an article on this central sensitization. Check it out. If your patient's central nervous system is all jacked up, then they're stuck in pain and anxiety. Remember stress management techniques like breathing exercises, progressive muscle relaxation, postural self-correction. These help reduce central sensitization and improve pain management. Remember that pain management is the first step in my simplified treatment approach. With chronic pain, it's like your patient's nervous system, his alarm system is set to on. We call this central sensitization. It isn't about fixing something that's broken. It's about retraining your patient's body to respond to the pain in a more appropriate manner. This takes time. We talked about pain-free exercises and not making things worse. This is part of stress management. There are other things in your patient's life that are impacting them. That's where your patient may benefit from talk therapy with somebody else. So we need to get rid of this typical physio approach that patients have flaws and that they're moving wrong. That's why I push for a functional approach and this patient empowerment idea. Shift the focus from a perfect form to a functional approach that allows us to better address our patients' unique needs and capabilities. By prioritizing function over flaws, we can empower our patients and improve their outcome. How do you balance striving for improvement with embracing a unique functional needs of each patient? What strategies have worked for you? Let me know in the comments below. My 2 books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and from injury to recovery through exercise. Simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. A super cool video is ready for you right here, and join our community of subscribers to stay ahead of the curve. Thank you.